price tag can be appealing to consumers, but the 5 on Your Side investigators reveal tonight taking a generic drug can also have dangerous consequences.
Sarah Buttison analyzed formulas and discovered cost-cutting medications are not created equal, and she wondered why.
It's like you're playing with people's lives.
Judy Scandera never imagined what would happen when she switched to a generic medication.
It scared me because I didn't know what was going on.
Judy has epilepsy and suffered seizures for the first time in years.
I ended up in the hospital for a week, and they couldn't figure out why.
Her body couldn't tolerate the generic version of one of her medications, something Lacey Wood with the Epilepsy Association says happens regularly.
We probably have a handful of our 65 open clients that are unable to take the generic medications.
It's not just epilepsy drugs. Our 5 on Your Side investigation uncovered problems with several generic medications. The FDA requires generics use the same active ingredient as name brands, but they can use different inactive ingredients like fillers and binders, and those can change how the drug is released into your system.
It's more than a little anxiety provoking when you write a prescription and you don't know what your patient's going to get.
The FDA began investigating the effectiveness of generic versions of the heart drug Toprol XL after Cleveland Clinic cardiologist Harry Lever sounded the alarm.
What I started to notice with the generic version of the drug was that the heart rate and blood pressure were not as well controlled, and the patients were having more symptoms of chest pain and shortness of breath.
Just about everything in the psychiatric realm that's gone generic since 2006, we've had significant problems with.
Psychiatrist Russ Johnson has been tracking issues with generics for 8 years.
It can have tragic consequences all of a sudden if you've got something that's a life-saving medication that isn't working.
Commonly diagnosed health issues like depression, insomnia, and high blood pressure also have higher rates of complications when patients switch to generics. Many reporting headaches, nausea, even seizures. Most reporting it stopped working.
Very often they'll think, okay, I need a new medication or I need the dosage adjusted. They don't think that there's something actually wrong with the pill.
Switching back can be a challenge. Insurance companies often refuse to cover name brand drugs, instead pushing cheaper generics.
It might be cheaper, but it's not the same.
With Lacey's help, Judy fought to force her insurance company to cover the name brand medications she needs.
When the brand is working on me and controlling my seizures and stuff, I don't see and I don't feel that it's right that I should have to change to a generic.
The FDA declined to comment on camera. They sent us a statement saying consumers can be assured generic drug products have met the same rigid standards as name brand. But at times, something unexpected is discovered about how a product works in the body after the drug is approved. On Your Side, I'm investigator Sarah Buttison, News Channel 5.